PTSD and ketosis. Can the ketogenic state support healing after trauma? Post-traumatic stress disorder, PTSD, is often described as an invisible wound, one that reshapes the mind long after the traumatic event has passed. Characterized by intrusive memories, hypervigilance, anxiety, emotional numbing, and chronic sleep disturbances, PTSD is far more than a psychological scar. It is a condition deeply rooted in the biology of the brain. As the field of metabolic psychiatry grows, researchers are turning their attention to ketosis as a potential ally in the complex journey of trauma recovery. PTSD affects several key regions of the brain. The amygdala becomes hyperactive, increasing fear and emotional reactivity, while the prefrontal cortex, responsible for rational thought and emotional regulation, loses some of its control. Meanwhile, the hippocampus, central to memory and emotional processing, may shrink under prolonged stress. Alongside these neurological changes, chronic inflammation and impaired glucose metabolism add further strain, creating a brain that is exhausted, unstable, and overwhelmed. Ketosis, the metabolic state in which the body burns fat for fuel and produces ketone bodies, has drawn interest for its potential to stabilize this fragile landscape. Ketones such as beta-hydroxybutyrate, BHB, provide a clean, efficient energy source that can bypass damaged glucose pathways, offering more consistent fuel to a brain struggling under the weight of trauma. For individuals whose PTSD symptoms worsen with blood sugar swings, irritability, panic, brain fog, this metabolic stability may offer a degree of calm. Ketones also appear to have anti-inflammatory properties, helping counter the systemic inflammation that often accompanies PTSD. Lower inflammation has been linked to improved mood, better cognitive clarity, and reduced anxiety, effects that may support the emotional regulation disrupted by trauma. Early research further suggests that ketosis may increase levels of GABA, the brain's primary calming neurotransmitter, which is often underactive in individuals experiencing hyperarousal or anxiety-driven symptoms. Another area of interest lies in mitochondrial function. Trauma and chronic stress can impair these tiny energy-producing structures within brain cells, reducing resilience and cognitive stability. Ketosis has been shown to support mitochondrial repair and even stimulate the growth of new mitochondria, potentially strengthening the brain's capacity to recover. While research is still in its early stages, several studies in animals and early clinical exploration point towards meaningful effects: reduced anxiety-like behavior, improved cognitive function after traumatic brain injury, a condition frequently seen alongside PTSD, and greater neurological stability when ketones are available as fuel. Although ketosis is not yet an established treatment for PTSD, its potential benefits have drawn attention from clinicians exploring metabolic approaches to mental health. It is important to emphasize that ketosis is not a replacement for therapy, medication, or professional guidance. PTSD recovery requires a comprehensive, often multi-layered approach. But for some, nutritional ketosis may act as a supportive foundation, offering steadier energy, improved mental clarity, fewer blood sugar crashes, and a calmer internal environment in which therapeutic work can take place. Lifestyle factors also play a powerful role in this equation. Sun exposure, quality sleep, structured routines, strength training, breathwork, and community connection all contribute to a more resilient nervous system. When combined with a ketogenic way of eating, these habits may help individuals with PTSD feel more grounded and better equipped to face the challenges of healing. As interest grows within both neuroscience and nutrition communities, one message is becoming clear: the brain is metabolically sensitive, and the fuel we provide matters. For those navigating life with PTSD, ketosis may offer more than weight loss or physical health benefits. It may help stabilize the very systems that trauma has disrupted. While not a cure, it represents a promising area of exploration and a reminder that sometimes the path to emotional recovery begins with the biology of the brain itself. Disclaimer: this article is intended for general informational and entertainment purposes only. It is not medical advice, and it should not be used as a substitute for professional diagnosis or treatment. Always seek the guidance of a qualified healthcare provider before making any changes to your diet, lifestyle, exercise routine, or medication. Stay updated on the latest news, connect, interact, and more on KetoNet, available on the Apple Store and Google Play.